Skin preparation for surgery, also known as preoperative skin preparation, is vital for reducing the risk of surgical site infections. The first step is cleansing the skin with a mild soap or antibacterial solution, followed by rinsing with sterile water. Next, the skin is disinfected with an antiseptic solution like povidone iodine or chlorhexidine to reduce microorganisms. The skin is then dried with a sterile towel. An antimicrobial agent may be applied to reduce infection risk. Hair removal, if needed, is often done just before the procedure to minimize bacterial introduction. Sensitive areas like the face, genitals, and skin folds may need gentle preparation. Nail hygiene, including cleaning and trimming, is emphasized for hand or arm surgeries. Fasting before surgery is an essential part of preoperative preparation. This helps reduce the risk of aspiration, which can lead to aspiration pneumonia. For adults, solid food should generally be stopped at least 6 to 8 hours before surgery. This includes meals, snacks, bread, meat, and vegetables. Clear liquids can typically be consumed up to 2 hours before surgery. Examples include water, clear fruit juices without pulp, broth, and tea or coffee without milk. For children, fasting durations are usually shorter. Breastfeeding infants can continue until 4 hours before surgery, and formula-fed infants should stop about 6 hours prior. Clear liquids are allowed up to 2 hours before. Exceptions to fasting guidelines apply to patients with diabetes or other medical conditions, or those who are obese or have a history of GERD, who may require special or longer fasting periods. Emergency surgery patients may not need to fast. Avoid alcohol in the 24 hours before surgery. Also, do not chew gum, suck on candy, or smoke, as these can interfere with anesthesia and healing. Fasting guidelines are essential to reduce the risk of aspiration, where food or liquids enter the lungs, and other respiratory complications during surgery. Adhering to these guidelines also reduces the risk of anesthesia-related complications, such as nausea and vomiting. Prophylactic antibiotics are given before surgery to prevent surgical site infections, which can lead to complications like wound infections, abscesses, and sepsis. For clean surgeries, such as orthopedic or thyroid surgery, cefazolin is commonly used. Alternatives like clindamycin or vancomycin are used for patients with penicillin allergies or MRSA risk. Clean contaminated surgeries involving the gastrointestinal or genitourinary tract may use cefazolin plus metronidazole or ceftriaxone. Piperacillin tazobactam may be used for higher-risk procedures. For contaminated surgeries, such as trauma or bowel surgery with perforation, common antibiotics include piperacillin tazobactam or ceftriaxone with metronidazole or clindamycin. Dirty surgeries involving actively infected tissue require combinations such as ceftriaxone or piperacillin tazobactam plus metronidazole or clindamycin. Coverage for resistant organisms may include vancomycin or Lenzolid. For cardiac surgery, cefazolin or cefuroxime is typically used. Vancomycin or clindamycin is an option for those with beta-lactam allergies or MRSA risk. Thank you for watching this video on preoperative preparation.